Hi, welcome to this section of cardiology. This is Dr. Jaitly. In this particular section, I'll be talking to you about a very common arrhythmia called atrial fibrillation. What is atrial fibrillation? Atrial fibrillation is the time when the atria are chaotically beating more than 300 times a minute. But the ventricular rate, as it traverses from this atrioventricular node, which is point 2, it slows down to about 100 to 150. So the atrial rate is about 300 and over. The ventricular rate is about 100 to 150. Still not normal. Normal rate for ventricular rate is about 70 to 80 because that's what the normal heartbeat or pulse beat is, 70 to 80. So now what initiates it? We know either of the two atria can do it because the atomicity starts somewhere closer to the pulmonary veins in the left atrium. Remember, this is the right atrium, left ventricle, left ventricle, just to refresh it. Now, around the pulmonary veins, there are certain cells that have been identified which have a propensity or an atomicity potential that they can initiate an atrial fibrillation for certain scenarios, which we'll just talk about when, say, the left atrium is stretched or is enlarged. Those cells, they tend to develop an atomicity and generate an atrial fibrillation. Now, obviously, the chaotic impulses will traverse both the atria first till they arrive at the AV node, which is sitting at point 2 here, as I said. Now, the AV node has an inherent filter so that all the 300 impulses, it's like a protection that the heart has, that if, say, all the 300 pulses generated, they traverse into the ventricles, the person would be dead. Thankfully, we have an AV node which slows down the conduction. It's like a sieve, if you will. So out of the 300 pulses, it's almost like, I'll give you an example. It's like getting on a ramp when you're about to approach a highway. What happens is only as many number of cars will get into the highway, slowly from the ramp. Not all the cars can just get in, right? Because there's a constant traffic going and you have to just allow for those, intermittently those cars to get into the highway. Similarly here, what happens is there's a refractory period where the pulses arrive, even though they're arriving at such a fast rate of 300 a minute, the filter is such that it'll allow only about 100 to 150 the most to accommodate, to send them to the ventricle. Still very fast, but at least it's viable. It's the condition can still be viable, but needs treatment because you have to slow down the heart rate. Anyway, so that is the whole mechanism as to how the atrial fibrillation functions. Now, what are the causes? The causes are dilated left atrium. Like I said, it originates from the pulmonary veins, endocardial cells here, or those cells that have atomicity, inherent atomicity. So mitral valve disease like mitral stenosis, mitral regurgitation will do it. Uncontrolled hypertension when the left atrium is stretched out and normally is also enlarged in hypertensive individuals. Heart attack when the ventricles are weakened or it's an acute event, so that can generate atrial fibrillation. Hyperthyroidism, sick sinus syndrome, when the sinus node is sick, it will be showing as bradycardia and tachycardia as well as atrial fibrillation, and all sorts of sick sinus arrhythmias can be seen. Pulmonary disease where there is hypoxia and low oxygen content, bad pneumonia, for instance, or sleep apnea, and especially in obese people. So when they have a sleep apnea at night, they can generate increased left atrial pressures, and as a result, they can have intermittent atrial fibrillation, which we'll talk about. Congestive heart failure, again, the mechanism is the same. The left atrium enlarges, and it's a low flow, and the left ventricle is also sluggish or not moving too well. Alcohol is a very important entity, including the illicit drugs like stimulants people use. So alcohol, certainly, especially binge drinking, some people are very prone to develop atrial fibrillation in that setting. And then there's the last cause, which is not known, because even in the presence of normal hearts, normal individuals who have normal hearts, there is atrial fibrillation in them, and those are called lone fibrillators or lone atrial fibrillators. Okay, so in an echo, one would see a large left atrium. Moving to the right panel, left ventricle would be weak if there was a heart failure. You could have pulmonary disease, and therefore one could see increased left atrial pressures, or in obesity, one would see also left atrial pressures could be elevated because of sleep apnea, and so on and so forth. So those will be the findings on the echo. And then, of course, if somebody has had a heart attack, then the muscle wall would be weakened. Heart failure, again, globally or regionally, the left ventricle function will be weakened, and alcohol intake can sometimes be seen as atrial fibrillation in that individual when somebody comes into the emergency room after binge drinking, especially the young individuals. Symptoms are palpitations, shortness of breath, fatigue, dizziness, chest pain, confusion, and syncope. That means loss of consciousness can also occur if the heart is weak and the heart rate is very, very rapid. Complications mainly are stroke and heart failure, and both are very, very dangerous complications, and therefore the treatment will really want it to prevent these complications. Therefore, we want to control the atrial fibrillation rate, and therefore there are medications and drugs to control that, which we will discuss at a later time in our next video presentation on atrial fibrillation when we discuss the treatments vignette. But just so that you know, the causes are numerous, and it arises most commonly in the pulmonary veins tissues surrounding it. The symptoms are, of course, straightforward: palpitations, dizziness, and chest pain and confusion. And acute, chronic, and intermittent are the common varieties. Thank you for your attention. I'll talk to you again.